name is Lipa.
Hello, I'm Ainil Hana.
Hi, my name is Ayu.
Assalamualaikum and greetings to our lecturer for this subject, Dr. Gila Shadia. Today our group will explain about chapter pregnancy, childbirth and puerperium. For this chapter, we will use code from O00-O9A. Code from this chapter only used on maternal record, not on newborn record. We will use for conditions related to aggravated by pregnancy, childbirth or puerperium, which maternal causes or obstetric causes. Trimester are counted from the first day of the last menstrual period. They are defined as follow. First trimester, less than 14 weeks 0 days. Second trimester, 14 weeks 0 days to less than 28 weeks 0 days. Third trimester, 28 weeks 0 days until delivery. Now, we move to the general rules for obstetric cases. General rules for obstetric cases consist of 6 points. First thing first is codes from chapter 15 and sequencing priority. This chapter has sequencing priority over codes from other chapter, and we will use additional codes from other chapter conjunction with chapter 15 to further specify conditions. We should document the pregnancy is incidental to the encounter and then code ZT3.1 pregnant state. Incidental should be used in place of any chapter 15 codes. Second is chapter 15 codes used only on maternal record, which means we cannot record of the newborn. Third, final character of trimester. The time frame of the trimester are indicated at the beginning of the chapter. Certain codes have character for only certain trimester because the condition does not occur in all trimester, but it may occur in more than just one. For the current admission or encounter, the trimester or number of weeks should be documented by the provider. This include pre-existing condition as well as those that arise during or result from pregnancy. The provided documentation or number of week can be used to assign the trimester code. Number 4 is the selection of trimester for inpatient admission that encompass more than one trimester. Pregnancy complication can happen at any time of the pregnancy, but when a patient is in hospital for a while, the trimester character for their code should be determined by the trimester at which they were admitted, not by the trimester at which they were discharged from the hospital. A character for trimester at the time of admission or encounter should be used if the condition started before or representation of condition that was already there. Fifth, unspecified trimester. Each category that has code for trimester has a code for unspecified trimester. The unspecified trimester code should only be used when there isn't enough information in the record to figure out the trimester and isn't possible to get more information. And last but not least, 7 character for fetus identification. A 7 character should be added to certain categories: O31, O32, O33.3, O33.6, O35, O36, O40, O41, O60.1, O60.2, O64 and O69 to identify the fetus for which the complication could apply. The 7 character should be 0 in the case of single gestations, when there isn't enough information in the record to figure out which fetus was affected and it is not possible to get more information, when it isn't possible to tell which fetus is affected. Now, we move to the next part.
Now, we'll continue about what is a selection OB principle of first list diagnosis. So, let me talk about this point. The first one is a routine outpatient prenatal visits. A code from category Z34, encounter for supervision of normal pregnancy, we must be used as the first list diagnosis for routine outpatient prenatal visits with no complication. Second, supervision of risk pregnancy, and this category or 09 code is only used during the prenatal stage and the complications during labor and delivery as a result of a high risk pregnancy, and then should be the first list diagnosis. And if no complications exist, assign 080 encounter for a full-term uncomplicated delivery. Next, episodes when no delivery occurs. The primary diagnosis should relate to the primary pregnancy complication that result in the encounter. If there are multiple complications, all of which are being treated or monitored, any of the complications codes may be sequenced first. Fourth is when a delivery occurs. This point discusses when a patient is admitted, the diagnosis that is delivered during the admission should be a sequence as the primary diagnosis. For example, in this case of a caesarean delivery, a patient with a condition that needed the caesarean surgery should be labeled as the primary diagnosis. And lastly, outcome of delivery. When a delivery occurs, a code from a category Z37, the outcome of delivery should be entered on every maternal record. These codes should not be used on future records or the newborn record. So next we move to what is meant by pre-existing condition versus condition due to the pregnancy. At this point, we can see that in this chapter differentiated between mother conditions that exist before to pregnancy and those that are a direct result of pregnancy. In order to assign the appropriate code as a condition occurs postpartum during the delivery encounter, it is acceptable to use codes specifically for the puerperium with codes complicating pregnancy and delivery. And then we continue about pre-existing hypertension in pregnancy. So, what do we think about this point? Okay, when assigning one of the O10 codes for hypertensive heart disease or hypertensive chronic kidney disease, a secondary code from the appropriate hypertension category must be included to identify the kind of heart failure or chronic kidney illness.
So let's move to another guideline in this chapter, which is fetal condition affecting the management of the mother, also involved in uterus surgery. So in this subtopic, code from O35, which is maternal care for non or suspected fetal abnormality and damage, and code from O36, maternal care for other fetal problem should be assigned. Okay, next we move to HIV infection in pregnancy, trouble, and the puerperium. Did you know that the patient during this condition admitted because of an HIV-related illness should receive a principal diagnosis from subcategory O98.7 followed by other codes for HIV-related illness? And patient with asymptomatic HIV infection status should be assigned with O98.7 followed by Z21. And the other guideline is diabetes mellitus in pregnancy. Did you know that recent studies have shown that Asian women are at a higher risk of developing gestational diabetes mellitus? And during this condition, code from category O24 should be assigned followed by the appropriate diabetes code E8 until E13 is assigned to pregnant women who are diabetic.
Next, we move to the guideline of sepsis and septic shock complicating abortion, pregnancy, childbirth, and the puerperium. These specific code types of infection should be assigned as additional code, and if severe sepsis is present, code subcategory R65.2. The code R65.2 are applicable to infections with associated acute organ dysfunction, sepsis with acute organ dysfunction, sepsis with multiple organ dysfunction, and systemic inflammatory response syndrome due to infectious process with acute organ dysfunction. To use this code first the underlying infection such as sepsis following complete of unspecified spontaneous abortion, sepsis following with incomplete spontaneous abortion, and sepsis following with induced termination of pregnancy. Next, let's move to the guideline of alcohol, tobacco, drug, and use of pregnancy, childbirth of the puerperium. When a mother consumes alcohol during or after her pregnancy, the code O99.31 should be assigned. And for future codes to identify the manifestation of alcohol use the code category F10. Following that, code O99.33 should be assigned to women who use tobacco, which complicates the pregnancy, childbirth, and the puerperium. To identify the type of tobacco, nicotine dependence use the code category F17. For drug complicating the pregnancy, childbirth, and puerperium, code subcategory O99.32. Assign codes from category F11 till F16 and F18 to F19 to identify the manifestation of drug used during pregnancy and postpartum. The last guideline is normal delivery. When a woman is admitted for a full-term normal delivery and delivers a single healthy infant without any complications antepartum, during the delivery or postpartum during the delivery episode, code O80 should be assigned. Remember, code O80 is always going to be the principal diagnosis, and additional codes from other chapters may be used with the code O80 if that is unrelated to or complicate the pregnancy in any other way. Next, code O80 permits episiotomy, and code Z37.0 is applicable to maternity records only. To summarize what my roommates and I have presented, the codes in Chapter 15 of ICD-10-CM pertain to the mother's medical record or encounter unless the physician confirms that the condition is incidental to pregnancy, and any other condition observed during the pregnancy or postpartum periods are assigned to this chapter as complication. Obstetrical care or medical care given during pregnancy and delivery is divided into 3 stages, which is antepartum, labor and delivery, and postpartum. So, that is all from Chapter 15. We hope that you found it helpful, and thank you. Have a nice day.